So today we will discuss about another important, very important organism. This organism I think you have heard about is called as Pseudomonas. So the story goes back in the early 1800s when antibiotic therapy was not much prevalence of an use. Sometimes the surgeons used to see that open wounds used to get infected and the gauge pieces when removed showed greenish colored pus. And most of the time the outcome was very poor outcome. Now this organism was later found out to be as Pseudomonas aeruginosa. Now an important significant part is that if you can see on this liquid media, can you see a greenish tinge over the top? This signifies two important things. First is it is producing a pigment that is greenish in color, and second important part is that that greenish pigmentation is seen in the top part. That means where it is coming in contact with the air. Okay. So what does this word Pseudomonas means? Actually the naming is slightly not accurate naming, because the person who named him discovered this type of bacteria and named them as monads. Monads means belonging to mons or group. If you recall, there is called as monada in the classification of the kingdom. The monada basically means group. So he discovered this special type or special group of bacteria and he called them as monads. And he thought this was slightly different from other groups. Hence he called it as pseudomonads. Okay. Eventually down the line you will come across many other organisms like aeromonas, plesiomonas. These also belong to those groups. However, current classification classifies this with non-lactose fermenter. Okay. Another important word is the aeruginosa. This means a Latin word erugo, which means copper rust or verdigris. Verdigris means green. Because this organism used to produce green color, this was called as Pseudomonas aeruginosa. Okay. So when from where it was isolated, I have shown you the picture. From the greenish pus that used to get collected on the gauge pieces, this organism was isolated. That comes to the identification and naming of the organism. Now, what this organism is? First of all, it is a gram-negative bacteria and it is an obligate aerobe. What do you mean by obligate aerobe? It cannot survive without oxygen. Hence, you can see on that tube, the growth was predominantly at the top half. Then it is non-spore-forming. That what do you mean by non-spore-forming? Why is it important? Now, why? If I know a particular bacteria can form spore, hmm? That is an important, very important point. It is very difficult to disinfect because then we have to go for sterilization. Furthermore, if any bacteria forms spore, it can survive in the environment for a prolonged period of time, and it can also be used as a mode of infection. Spores can be infective. Hence, because it is non-sporing, we don't have to deal with this. However, it is capable of causing many types of infections, not only in immune compromised patients but also in immune competent patients. So, furthermore, another extremely challenging part with this organism is antibiotic resistance. I am not going to delve much deeper into antibiotic resistance because you have not been taught about the antibiotics, but I will give you just a simple very idea. In the classes I think I have told you some very little about groups of penicillins. Do you recall anything? There is a natural penicillin, then there are the aminopenicillins, then there are the uridopenicillins, right? And there is one particular group of penicillin among the urids called piperacillins and ticarcillins. What is the advantage of these two drugs? These types of penicillins have very small molecule. This small molecule can penetrate into the bacterium itself. Hence, they are effective against Pseudomonas. Generally, an approximate idea I can give you, from where does this antibiotics enter into a bacterial cell? There are specific areas called as poring channels through which any material enter into the bacterial cell. So any antibiotic molecule will enter through the poring cells. I'll just give you an approximate idea that a Pseudomonas bacteria will have about 30% of the poring cells as compared to a enterobacteria like an E. coli. So this will give you an idea how difficult it is for an antibiotic to penetrate within a Pseudomonas bacteria. Hence, as of today, one of the very resistant organisms that we can find is Pseudomonas. And this further situation is complicated by the hospital or healthcare associated infections caused by Pseudomonas. Now let us look at the important features. First is this organism is ubiquitous. When I say ubiquitous, what does it mean? Any idea? Present everywhere. Everywhere means where? Is it present in air? Is it present in say soil? First of all, remember it's an obligate aerobe. So it will always be a surface dweller. It cannot survive underneath the soil surface, or it cannot survive within the gastrointestinal tract of humans and animals, because those are not aerobic environment. So these are surface dwellers. Furthermore, this organism is associated with water, both fresh water and non-fresh water, and it can survive in that. Next, it can be isolated from various sources, and it can survive on minimal nutritional requirements. That is the reason why it can survive even in hospital environment. Suppose in a particular ward there is a patient who is infected with Pseudomonas. So this organism can spread from this patient to the surroundings. Now hospital environment is not a very nutritive environment for any organism, yet it can survive in that environment because it has got very minimal nutritional requirement. Next important is it can tolerate a variety of physical conditions. To such an extent, in the laboratory, I have already told you this organism produces pigment. If we incubate at say at 42 degrees centigrade, the pigment concentration increases. If we put any other bacteria and put it at 42 degrees centigrade rather than 37 degrees centigrade, what will happen? That organism cannot survive that temperature because that is accustomed for survival at 37 degrees centigrade. But this organism not only survives but also increases its pigment production. This can be found on respiratory therapy equipments like ventilators, humidifiers, intubated patients, BiPAP machines, antiseptic solutions, even soaps, which we generally consider to be as disinfecting in nature. It can even survive on soaps, sinks, mops, anywhere there is an access of water, this organism can survive. If you have understood this feature, then you can understand that whenever a patient is in hospital, what are the common sources from which water comes? Is the sinks, the bathrooms, the respiratory equipments, and the air conditioners. Hence, in the hospital, you can very commonly see ventilator associated pneumonia or ventilator associated events caused by this organism. In community, we can find it in swimming pools, whirlpools, freshwater ponds, etc. Even in household water. Now, you have seen the pigment, green color pigment. Various species of Pseudomonas produces various types of pigments. The first pigment is called as pyocyanin. I think as the name suggests, cyanin means blue. Pyo means because it produces pyogenic infections. So, pyo means pus. So, pyocyanin is blue color. Pyoverdin means green. Pyorubin is a reddish color pigment and pyomelanin is red to black color pigment. These are the some common pigments. Now, if you can see, there is a greenish color pigment. Can you see in this culture media? Look at the colonies. Then look over here. It's green. This is blue in color. This one is pyorubin, red in color, and this is slightly dirty brown in color. This is pyomelanin. So these kind of pigments may be associated. Coming to other features, this organism is motile, vigorously motile, and it is motile by what? Single or multiple polar flagella. And I have already told you they are obligate aerobes. Now coming to, now look at this. These are the two GIF formats. On that, on the left hand side of the picture, you can see the hanging drop preparation in which the organism is motile, and this is the motility of the Pseudomonas when it spreads through any tissues or infections. It will start reproducing and move in this way. So this is a gram-negative bacteria when stained, and it is oxidase positive. What do you mean by when I say oxidase positive? Any idea? তো পড়ো না এখন পর্যন্ত অক্সিডেজ টেস্ট কেন করা হয়? লিখে রাখো, পড়ে আসবে। সিউডোমোনাস যদি পড়ে অক্সিডেজ জিজ্ঞেস করা হবে, ঠিক আছে? রিএজেন্টটার পুরো নামটা বলছি না, শর্ট ফর্ম হচ্ছে টিএমপিপি, পুরোটা পড়ে এসো, অ্যাটলিস্ট রিএজেন্টটার নাম বলতে হবে, ঠিক আছে? So this is a very common test by which we can identify Pseudomonas directly from the culture plate. There are many methods of performing oxidase test. A very simple method is we take a filter paper and put a drop of oxidase reagent, that is the TMPP solution. After that, on the filter paper, we take the organism on a cover slip and then smear on the filter paper. This organism will react with the and produce a blue colored pigment. And if it does produces, we call it as oxidase positive. Okay, this test you have to perform if in your examinations Pseudomonas is given. However, some specific things that you must know that you could be asked in examination. What are the precautions that you should take while performing oxidase test? The first thing is that you have to do the test on a non-lactose fermenting organism. Why? Because if you are taking a colony from a lactose fermenting organism, that means it will be producing acid. That acid can give a false positive reaction. Secondly, when we are picking up the colony, we have to pick up the colony with an inert material like glass. Commonly we use a cover slip. Why? If we take it on a metal loop, the metal ions on the loop can react and give a false positive test. Hence, in the examination, if you are asked how have you performed the test, you will say I have put a drop of the reagent on a filter paper, and then from the culture plate I have taken a non-lactose fermenting colony on a cover slip and smeared on the filter paper. Then the reading is taken within about 5 to 10 seconds. And if a blue color develops, that means this organism is positive for oxidase, hence this organism is probably Pseudomonas. At your level, oxidase positive gram negative organism is Pseudomonas. Okay. Next important part is that because it can survive on minimal nutritional requirement and it is of oxidative nature, I am not going into the oxidative reactions. If you want, you can study, but I think that will not be required as far as the practical purposes are concerned. Now, these are the various reactions of which media? Triple sugar ion media. Okay. Now, if you look at this is an uninoculated media. Look over here. This is the growth of Pseudomonas. There is no reaction seen over here. Okay. Why? Because in the bud there will be no growth, because that is slightly anaerobic environment. In the aerobic part, we can only see the utilization of the amino acids, hence alkaline kernel is developed. Okay. So the reaction will be K by K as compared to the other reactions that you can see, where there is A by A reaction or K by A reaction, and this is a K by A reaction with H2S production, just for comparison. So if we do inoculate TSA, we will get a alkaline by alkaline reaction. Now, on blood agar, we can see hemolysis. This organism can produce hemolysis. Various types of hemolysis can be seen. Furthermore, the type of the colonies that are seen, that can also vary. It can vary from smooth, round, moist, mucoid colonies to slightly irregular shaped colony over there. Look at the picture F, to confluent colonies in picture G, to irregular rough colonies and pigmented rough colonies like in picture J. So the characteristics of the colony may vary according to the strain that is given to you. Whatever the colony is given to you, like write down the characteristics of that strain. Okay. Very commonly what is seen is irregular colonies. Very commonly the type of colonies that are observed is this kind of colonies, slightly rhomboid in shape in single, and slight hemolysis may be observed on blood agar. These are the common appearances. There are many virulence factors of this organism. The virulence starts from capsule to pili to lipopolysaccharides, and it also produces toxins like exotoxin A, S, and cytotoxins. Okay. These all will eventually help in causing diseases. Now, what are the diseases? Look at this composite picture. The infections may start very commonly from localized infections. Localized infections, especially in the limbs. For example, a diabetic ulcer or a pressure ulcer can very commonly be infected with Pseudomonas. Next come any chronically injured tissue, for example, burn injuries. Those surface infections can also be caused by Pseudomonas. Then if you move on, this organism can also cause urinary tract infections, especially if there is any history of surgery or instrumentation. There are many kinds of urological instrumentation procedure patient may undergo, following which this organism may lodge into the scar tissue or the stricture and then cause chronic infections. However, acute infections are also very common. Furthermore, I have already told you in the hospital setting, this organism is associated with water. Hence, along with the humidifier, the ventilators, and the air conditioning outlet, this organism can cause respiratory infections. Most importantly, ventilated pneumonia or VAE, causing pneumonia. Furthermore, it can also disseminate into the blood, causing meningitis, endocarditis, and this organism can also cause corneal ulcer and endophthalmitis. Many of the people will be using uh, contact lenses for the vision correction. Those contact lenses are generally cleaned in a contact lens cleaning solution. This organism can survive in the contact lens cleaning solution. So if the person, while putting on the contact lens, especially with the hard contact lens, there might be small injury to the cornea, and from there corneal ulcerations and infection of the eye can occur. So overall, this organism can infect any part of the body. Okay. To summarize, the common infections are pulmonary infections. You have heard about cystic fibrosis. So what is cystic fibrosis? No idea. Cystic fibrosis is a genetic disorder in which there is a mutation of the CFTR gene, resulting in altered secretion of the mucus in the respiratory tract. Hence, the people affected by this disease will have copious mucoid secretion which they cannot expel out. So, very commonly, these patients are nebulized with saline so that they can expel out the secretions. And because they are routinely nebulized, they are very commonly infected with Pseudomonas. Next, another important is external otitis, because people will undergo swimming activity even in, not only in ponds but also in swimming pools, which we think are regularly cleaned and chlorinated. This organism can even survive on those swimming pools. So people who are swimming on those swimming pools very commonly will get ear infections. That is the infection of the external ear. This is called as swimmer's ear. Now there are the few pictures that I want to show. First is, in some cases of disseminated infection we can find, or this is also very commonly seen with Pseudomonas folliculitis. Folliculitis means infection of the hair follicles. Then there is a pressure sore which is infected with Pseudomonas. This is a case of peritonitis with intestinal perforation. Paronychia caused by, paronychia means infection of the finger of the nails of the toes caused by Pseudomonas. On the left hand side you can see is the corneal infection caused by Pseudomonas, and over here you can see the deep seated or chronic infection of a intraosteal implant. The surgery was done, after which the infection has spread. So these kind of severe infections may be caused by Pseudomonas. Now I think you have understood the gravity of how dangerous this organism is. Now coming to laboratory diagnosis, the specimen would be based on the type of the infection that we see, whether it's a urinary tract infection, whether it's a pulmonary infection. If it's a, we are thinking about pulmonary infection, the ideal sample would be a sputum or an bronchoscopic lavage, etc. For urinary tract infection, we can take the urine sample. For any deep-seated abscess, we have to take the aspirated pus. Commonly, culture is done on Meconian blood agar, and on nutrient agar, we can see the pigment if it is producing pigment. Next step would be to identify what kind of organism is it. On Meconian agar, we will be finding non-lactose fermenting colonies, that is pale or translucent colonies. If the pigment is produced, slightly greenish tinge or a metallic sheen may be seen. This metallic sheen because of the seen because of the pigment. Next, what test we have to perform? Because it's a non-lactose fermenter on a Meconian agar, next step that we have to perform is an oxidase test. Now, among all the tests that we have learned over the few classes, this is the composite. Now you can see on Pseudomonas, it is indole negative, MR negative, VP negative. Citrate reaction is positive. I have already told you all the organisms which can survive in the environment with a minimal nutrition requirement is able to utilize citrate. Hence, citrate utilization will be positive in case of Pseudomonas. On triple sugar iron media, you can find the K by A reaction on slanted but with no production of H2SO gas. Motility is, it is motile on hanging rock preparation, and furthermore it will be oxidase positive. So based on all these reactions, we can conclude that this gram negative organism is Pseudomonas aeruginosa. Now sometimes the examiner may ask you, how can you say that this is aeruginosa? Remember, the answer is in the name itself. Aeruginosa means producing pigment. So if the organism is producing greenish color pigment, you can say this is aeruginosa. If you think that it is not producing pigment, just simply say Pseudomonas species. Okay, it may or may not produce pigment. Have you understood that? If it is producing pigment, we can say it is Pseudomonas aeruginosa, because as the name suggests, aeruginosa is the one which produces pigments. Okay, so that is in short all about Pseudomonas aeruginosa. So in today's practical class, you will be given Pseudomonas aeruginosa plate. Please go through all the culture plates that are given on McConkey and nutrient agar. Observe the colonies very carefully. On your notebooks, describe the colonies as we have done previously. Then perform the oxidase test, Gram-Stein, and then write the full diagnosis. Okay. In your examinations, generally the questions will be given based on a clinical case scenario, and this organism will be given, and then further questions will be asked to you. Okay. So let us first concentrate on the practical part, then we will discuss all the case discussions later on. Your translution and slide. Sometimes you can see a shiny edge, or it is also called as metallic sheen. Next step would be to do the oxidase test. The oxidase test has already been performed to show you. On this filter paper, the TMPP solution is put. From this colony, we have taken a cover slip and smeared the colony directly onto the filter paper. After that, we can see the development of the bluish color. This development of bluish color depicts that this organism is oxidase positive. There is no how this procedure is done on a filter paper. We drop of TMPP solution. কত percent ওগুলো এখন তোমাদের জানা দরকার. First try to understand the concept of the test. Then on that we are smearing, taking the colony from the culture plate and putting it on the filter paper. It will develop the bluish color. Important question গুলো কি হলো এর মধ্যে, কি করবে কি করবে না. Always use a inert material to take the colony. Do not use the metallic, তাহলে loop use করা যাবে না. Loop can be used if it is made of plastic, মানে ডিসপোজেবল লুপ যদি দেওয়া থাকে. ঠিক আছে, যদি মেটালিক লুপ থাকে দেন ইট ক্যানট বি ইউজ. আমরা কি কমনলি ইউজ করতে পারি, কভার স্লিপ ইউজ করি, বিকজ গ্লাস ইজ ইনার্ট. আরেকটা হচ্ছে, নেভার ইউ শুড ট্রাই টু টেক আ কলোনি which is pinkish in color on McConkey. That means that's a lactose fermenting, so it will be fermenting, it will produce acids. The acids can give a false positive result. So a gram negative organism which is producing pink green color colony on nutrient agar and is oxidase positive, your presumed diagnosis is Pseudomonas aeruginosa. If there is no pigment, you can say this is Pseudomonas species. Now because the color is being produced, you can say it's Pseudomonas aeruginosa. ঠিক আছে, আজকে Gram-Stein করো, দিয়ে পুরো এটা লিখে দাও. ঠিক আছে. এক জায়গায় দুটো বানানো যাবে.
ধরা হচ্ছে না। थोड़ा नहीं लगे भाई না এরকম ঠেকাতে হয়ে যায় কে ছেড়ে দিয়েছে খুলে রেখে দিয়েছিস এটা থেকে নিয়ে ওখানে দিচ্ছি না এটা স্টেবিলাইজ করছি এটা থেকে এটা দিয়ে তারপরে দিতে হবে এটা শুকিয়ে নিতে হবে ওটা শুকানো হয়ে গেল দানা নিগো দিকে লাগবে দানা এটাকে খোলা করে রেখে দিয়েছি এরকম ভাবে কি স্টেজ এটা তো স্টেবিলাইজ করে না দেওয়ার পর টেস্ট করতে হবে